Less than 10% of Americans donate blood each year. Low numbers, considering that every 2 seconds, someone in the U.S. needs blood. Blood drives like this one at a school in the Upper West Side give New Yorkers plenty of opportunities to give blood. That is, unless you are a gay or bisexual man. The HIV/AIDS epidemic hit its peak in the 1980s, causing widespread concern, even paranoia. Little was known about the disease and why it was affecting so many gay men. Soon after, the blood supply became tainted, affecting people who received transfusions. As a result, the FDA placed a ban on male donors who said they had sex with another man after 1977.
I think, although there was opposition, people came to recognize that this was a population at risk. There was no blood test then. This was the only way to secure the blood supply, and it was done. And I think from an ethical point of view, from a policy point of view, it made absolute sense.
Several major health organizations have in recent years denounced the ban, saying that advances in blood testing make it no longer necessary. While the FDA considers modifying the ban, some gay men who want to donate just lie.
So I just sort of went along and, I just basically checked off that I wasn't gay in the checklist that they give you.
Once blood is donated, it must pass an HIV test before it is added to the blood supply. But the test doesn't always catch people who have been infected within the last 6 months. A negative test may actually be positive. Advocates of changing the ban understand this risk and have suggested that the FDA shorten the bar from a lifetime to 1 year. Christopher Morrow recently discovered that he was a possible match for a bone marrow transplant, but he soon learned that he won't be eligible to donate because of the ban.
I'm sure that if this person could know, the whole process is anonymous, but I'm sure that if this person could know, they wouldn't care and they would want it to continue.
For me, the bottom line is something which was justified 25 years ago on the basis of science and evidence and ethics is no longer justified today.
Bayer believes that the change will occur only if the President, Department of Health and Human Services, and the Surgeon General publicly ask the FDA to lift the ban. In the meantime, the discussion continues. Charise Frazier, Columbia News Tonight.